Dr. Matt, thank you for joining us today on the Compass Wealth Conversations. So you're a direct primary care model doctor, right? That's kind of the lingo for it. Can you describe what that is?
Yeah. So it's a membership based primary care practice. Our patients pay a flat monthly fee, anywhere from $50 to $100. It's age tiered. And what that gets them is a few perks that they wouldn't get at a traditional primary care office. So the first thing is more time with their physician. So any patient who signs up with us, the first appointment is typically an hour, nothing less. We delve into what are their specific health goals. Obviously, then we go into medical history, medications, family history, all this type of stuff. And that really kind of sets us up for the future and how we're going to tailor our management for that patient. So that's number one. And then any appointment after is at least 30 minutes. So our patients are never rushed. It's not your typical like 5 to 7 minute appointment at your primary, and then they kick you out the door type of
Mhm.
thing. So number one is time. Number two is direct access to us. So my patients get my cell phone number, so they can text me, they can call me, they can email me. If they have a quick question or a concern, it's very easy to get a hold of me, um, which is nice. Um, and probably the last thing I'd say is kind of dovetails with the access is we pride ourselves on like same day, next day appointments. So if a patient has a concern, they need to be seen. We usually get them in either that day or the next day.
So it's not like calling your primary doctor and be like, hey, I don't feel well. Here's what's going on. All right, maybe we'll do a telemed or maybe we'll see you in 3 months, right? Like it's kind of that. So they get your number.
Yeah.
So it's not just you, obviously, answer the phone. So there's more than one if they sign up for the primary direct with you.
So it's our practice is just me and my business partner. He's another physician.
Okay.
Um, so if you were a member of my practice and you said, I'm not feeling well today,
Mhm.
and I don't know if I should be concerned or not. A lot, it's just as simple as you shoot me a quick text. Hey, Dr. Matt, I'm not feeling well. X, Y, and Z symptoms. What do you think? Should we do a phone call? Should I come to the office? And depending on what you say, I can either text you back and be like, sounds fine. Just keep an eye on it. Or I'm a little bit more concerned. I have more questions. Let me give you a quick phone call. And or why don't you come to the office and let me examine you type of thing. The difference is that I can see you that day versus if you call your primary office, good luck trying to get a hold of your actual doctor who
Right.
takes care of you, because that's not going to happen. You're
Mhm.
going to get a secretary or some nurse who doesn't know you. That's number one. And number two, even if you were somehow to get your doctor on hold or on the phone, he or she is so busy that they're going to be like, I can't see you. You got to go to an urgent care. You got to go to the ER. Um, and I'll see you at your scheduled appointment. That's 6 months from now,
Mhm. Yeah.
which most patients are like, I mean, that's not really what I'm looking for.
Yeah.
I want to talk to my doctor because I'm sick.
Yeah, because they're going to follow up. Oh, we'll follow up in 6 months and see if anything's changed. And you're like, well, I just need to kind of know. I want to know now. Most people want to know now what's going on to make sure that they're good, right? So when you're doing that, and then most people go into their primary because they have to get a referral source to a different doctor, right? So how does that work? Is it any different coming through you, or is it your because of your network? Where are you referring and things of that nature?
Yeah, I mean, so I always tell patients just think about your traditional primary care doctor and all the things that they do. We can do that as well. Like we're both board certified in family medicine. Um,
Mhm.
so in terms of referrals, for example, yeah, we can provide referrals. So if someone needs to see a specialist, a nephrologist, a hematologist, cardiologist, we can write those referrals. If someone needs lab testing or they need imaging, they need medical equipment, we can write those scripts for those things. So we can do all that. The nice thing is that one, we don't need to refer out as much because we can spend more time with patients. A lot of times, like a patient comes in, they're like, my knee hurts. And a typical primary has to deal with that. They have to deal with blood pressure, they deal with cholesterol, your diabetes, also the cancer screenings you need. And they're like, I don't have time to address all this. So your knee hurts, go see a sports medicine doctor, go see ortho. Whereas we can be like, all right, let's address it and see if you actually need to see a sports medicine doctor, you actually need to see an orthopedic surgeon. Um, and if they do, we'll happily be like, hey, I'm going to refer you out. So that's
Mhm.
that's number one. Number two is we have pretty good relationships with a lot of specialists. So we're not beholden to any large health systems. If I say, hey, I know this orthopedic surgeon who's really good with knees, I want you to see this guy.
Mhm.
I can do that. Versus if I worked for a large health system, I won't give names, all of them operate the same. They indirectly but heavily incentivize their doctors to refer in-house.
Yeah.
So there may be a really good orthopedic surgeon at a different hospital system, but if you say you go see them, well, that's you're losing money for that hospital system. They don't like that.
Yeah, they don't like that because they all want to stay in network. So if you can name any kind of hospital you want, but that's really what they're going to stay into because they want
Yeah,
to just refer it through there.
yeah, exactly.
So what are the best types of patients for you or clients for you, right? Are we looking at we're millennials? We're looking across the board, right? Just people who want to be in contact with their doctor and actually want questions answered.
Yeah, I mean, so I answer that in two parts. So the first is we can take care of anyone from cradle to grave. So from the time they're an infant until, I had a patient who was over 100 years old at one point, and anywhere in between. And so the thing about being a primary care doctor is you know so much and you can handle so much, but a lot of people come to us for very different reasons. I have a family who's um, lives out in more Western Pennsylvania, but they're moving, closer to Southeastern Pennsylvania. Um, they're very hesitant with the traditional medical model and health insurance in general. So they want a doctor who isn't affiliated with a large hospital system taking care of their family, just bread and butter primary care for the family. So they signed up. That's a good. And then I got a patient who recently was just hospitalized, had multiple strokes, has heart failure, has really bad kidneys, and he needs a lot more time and attention from a dedicated doctor who can really be like, hey, let's put all these pieces together and just figure out like what's going on and also manage all these different specialists, make sure everything makes sense, like a really good quarterback. That's a patient. So it kind of varies in terms of that. Um,
Mhm.
and I'll say that kind of organically, we've developed a niche in a way with men who are interested in like testosterone replacement therapy.
Okay.
Me and my partner are two younger male docs. We're pretty fit. So I think we've naturally attracted that demographic. So we treat a lot of those individuals as well.
And how do you go about treating that?
Just like any other patient, they come in, we talk to them. Hey, what are your health goals? What symptoms are you having right now?
Mhm.
Has anyone gotten lab work on you in terms of what are your hormone levels and all these other things? So we talk about all that. Um, if we do get labs, we'll look at your testosterone levels, your estrogen levels, other different hormones and molecules, labs, I mean. Um, and then I'll have a discussion based on that. Be like, hey, let's start with lifestyle. What can we do from that perspective? What are you eating? How are you exercising? What's your sleep routine like? Um, all the way, and can that address the hormone deficiencies all the way up to actual testosterone replacement type therapy?
So are you just in the state of Pennsylvania? Or are you everywhere else? Can you be anywhere because of Zoom and telephone? Is that how it works?
So we're just licensed to practice in Pennsylvania,
Okay.
at least for right now. I mean, in the future, we may get licenses in other places to do more telemedicine. But yeah,
Okay, so that gives you kind of like the stronghold around here because not a lot of people are following this model, and more people want relationships with their doctors. Like they want to go back to the old school way, right? Where it was before they were given you to the bigger hospitals and things of that nature. They were corrected to it. They were your family doctor. You went and saw them. Like I know that my parents still see the same family doctor that we saw when we were kids, and I don't see the same doctor, right? So like you have a primary, you can't always get a hold of them because they're so busy. You're talking to a secretary and maybe they have time to see you if you can get in or whatever it is. So the best way about it is that you're giving them your number and your partner's number for constant contact, those types of, connectivity to the doctor, kind of like that old school feel of what you're going for.
yeah. I mean, I think that's perfectly put it. I mean, I tell people I want you to imagine like the old school doctor from the 1950s, like the local town doctor who had his little doctor bag with his stethoscope and his
Yeah.
blood pressure cuff and like walked from house to house and like actually went in the house and like took care of the entire family when they were sick or not. Um, that's what we want to get back to in a way, like have that type of feel. With patients, we do house visits as well, so we'll see people at their house. But that's the feel I think over the past 40 years medicine in general, but especially primary care, has kind of been bastardized in the way that there's so many kind of middlemen getting in between the patient and the doctor, that um, that old school feeling of the local town doctor is just gone. And we're trying to get that back. That's why we call it direct primary care. It's the direct relationship between the doctor and the patient, and we kind of eliminated all the middlemen.
So how did you get to this model, right? Like you're not the first, but more of less you are, I mean, that I know of around here. So how did you get to this model?
It's a great question. So in medical school, the first day of medical school, at least at our medical school,
Mhm.
they teach you that the best way to arrive at the appropriate diagnosis and treatment plan is your history and physical. So you need to spend time talking with the patient, asking a bunch of questions. When did your symptoms start? What aggravates your pain? What alleviates it? What other symptoms are you having? Et cetera, et cetera. And then you do a very thorough physical exam. You take those two together, you figure out, okay, based on my history and my physical, what blood work do I need? What potential imaging do I need to refer out? What's the treatment plan? So they just beat this into our head from day one of medical school. That's first and second year of med school. Third year of med school comes along, they're like, all right, guys, you're getting out of classroom, you're going into the hospital. And I just remember this switch where everything they taught you in first and second year about how important the history and physical is, kind of went out the window. They're like, hey, I get they taught you that, but here's how it works in the real world. You got very limited time. You got to go as fast as possible. We have a lot of people to see. So get it done. And I was like, well, that doesn't make any sense. Number one. And number two, everyone seemed burnout. All the doctors I saw just really didn't like it. Super
Because they're turning
frustrated.
and burning. You're turning and burning paces, and you're doing it to yourself because you have to continuously know who the next person you're seeing is, what they're up on, and what their ailments are. And you're only seeing them for what, 2 minutes, 3 minutes?
Definitely. And I think there's this internal monologue going in every doctor's head that's like, I know this isn't right. I know this isn't the best care I can provide, but for some reason I'm just stuck. And you could just see it. And I hated that. And my business partner, he hated it too. Luckily for me, I'm a free market guy by nature. It's just what I've gravitated to. I read on growing up. I literally went home one day from the hospital. I was like, this doesn't make any sense. I Googled free market healthcare on my laptop. Direct primary care popped up. There was a conference in Florida 2 weeks away. And so I was talking to my business partner. We were roommates in medical school at the time. And I was like, this seems pretty cool. We should just go check it out. So we swung it with our attendings to skip out on rotations and go to the conference. And everything, like the veil kind of uncovered in terms of the doctors were super happy. They were like, hey, like I'm really happy practicing medicine. I could provide really good care. They kind of broke down the model. And from that day on, I was like, this is what I want to do.
Mhm.
Um, so when we went to residency, everything with our suspicions in medical school was confirmed. I mean, COVID happened at that time too, so it was very busy. But I remember being, in the hospital. I had to take care of 30 people on my own. I mean, 30 sick people, you're flying.
Yeah.
And same thing in the clinic. I would have 4 rooms going. So like I would see you for just an annual physical. I'd be seeing Tom because he just went to the ER and he had this concern that he had. I'd be seeing another old lady who had multiple strokes and now is in acute heart failure. And I'm trying to figure that out. I have another lady who's coming in. She's postmenopausal and she's having hot flashes and she's wondering about hormone. And I'm just going as quickly as possible. Go, 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 go. And I hated it. Um, and so at the end of third year, me and my business partner, I was just like, are we doing this, man? Like, are we just gonna be the regular docs and go get a job somewhere? And we just kind of looked at each other like, screw it, let's just start. We're young. I mean, a lot of people say to us, why'd you do it starting out of residency? A lot of people are like, why don't you make some money, pay off your loans, and then maybe 5, 10 years start? We thought the opposite in terms of we felt that starting out as young docs was the best time because we were single, didn't have family, didn't have a mortgage. We knew what it was like to live very poor beneath our means, and we could build a business that way, kind of focus on that. And I think we made the right decision.
Yeah, it seems like you guys are. I mean, it is working, right? And
Yeah.
people are coming around to it. So it kind of leads to like those questions, like because people have traditional insurance. What are some of the problems you face, and what are the problems you see like clients face? Because they got to get out of that mindset, right? It's kind of like whether they're on a phone, like a phone thing. Hey, we have Verizon, but we want to switch to, Cricket or, whatever it is. Like they're looking to lower models. They're changing it because they're so used to this is the way it is, right? Now it's a different model. It can be a different model if they want to accept it.
Yeah. I think the amount of education I have to provide is shifting in terms of I need less and less. I mean, when there's a generational gap, I think younger people get it like almost immediately.
Yeah, absolutely.
They're young, like this makes perfect sense. I love it. Sign me up. Older people are a little bit more hesitant. I think they're used to the older model. So like, I have health insurance, I have Medicare. Why do I need you? Type of thing. And I kind of break it down. I'm like, hey, I know you know you're paying the monthly membership, but here's what you're getting, and here are the potential cost savings. For example, that time that you couldn't get a hold of your doctor and you had to go to the ER and spending $1,500. What if we could have spared you that? You didn't actually have to go to the ER. If you just called me up, we had a talk, you popped in the office, $1,500 you save. That's over a year of full blown medical care, in our practice type of thing. So I think that's number one. Number two, I think everyone kind of knows healthcare is screwy right now and is breaking down.
Yeah.
Um, Even if they're not paying attention to it, they're like, something's going on. It doesn't make any sense. Healthcare is messed up. It's not working. And you see like local hospital closures, like Suburban Community Hospital just closed. Everyone's merging. So you got these big players, Jefferson, Penn, Temple. And it just seems that the more they merge, the worse care gets. Then every year, insurance premiums can continue to go up. And then they say, I've had multiple patients say, I pay all these premiums every year, every month. And the minute I need care, I can't get it.
Right.
Health
Yeah.
insurance is just screwing people over. So every year that we do this, so it's just the pitch becomes easier.
Well, that's why the equity firms are going in. Like we had just had Crozier and Taylor close, right? Like they go in, they're ruining the hospitals. They're not giving it back to the community. That's
Yeah.
and people are losing jobs and doing things of that nature. Even when you see like Mark Cuban getting into like
Cost plus.
yeah, right. Is that something you guys use, or is that something that it makes sense across the board? I mean, just your thoughts on those.
Definitely. I mean, so before Mark Cuban, like we have relationships with suppliers, so we can get pretty cheap generic medications. So we've always offered that. Mark Cuban has just been an add-on for us because they direct mail it to the house. Patients don't have to come pick it up at the office. So I use it a lot. I always have a discussion with them. Hey, like, how much are you paying for medications? If you have an insurance plan that fully pays for it, great, keep it going. But if you're like, I don't know, I'm paying like X, Y, and Z, we kind of break it down. Okay, well, maybe we can save you some money here by doing, these potential options either through us or through Mark Cuban Cost Plus.
Are there any other challenges that you see from making the switch? I know that the younger generation is going to get it because they know. I don't want to say subscription model, but it's really what it is, right? Like you're paying a monthly fee, so they have connection to you, right? Just like they have connection to Netflix or Paramount Plus or whatever it may be, or their local like beer delivery. It could be anything, right? I mean, everything's gone that way. So the primary care piece for you is that connectivity. Are there any other challenges that you really see? I mean, besides the mantra for the older client?
I think the wind is at our backs moving forward in the sense that everything in healthcare is kind of crashing before our eyes. So even the older generation, there's going to be a wave of older doctors who are retiring very soon. I was talking to one office manager of a local ophthalmology office who was like, you guys are like unicorns in terms of your young primary care doctors practicing primary care. Like that doesn't happen anymore. And all the older primary care docs, they're going to be leaving, retiring soon. But also, too, I have Medicare patients who have signed up who said, to be honest with you, I was hesitant to sign up.
Yeah.
I didn't know if it made sense, if I was just wasting money. But I'm so happy that I signed up. And they tell people all the time about our clinic.
Yeah, we always just say like have the conversation. Just it's something you should research, look at, and then have the conversation about. Because once you have the conversation, it will make sense to you long term.
Yeah.
Like when we walk in and we're using for like financial teams, we bring a team with you. Like you're part of our team, right? Like we do refer you guys out. It's more of like, hey, who are you using and why are you using it, and is there a better way?
Yeah.
And then people are like, okay, I can figure out the better way.
But that's what patients want. I mean, it's healthcare is so weird in the sense that it's the one area where like you get health is so sacred to everyone. If you don't have health, you don't have anything.
Right.
Right. And yet we spend so little time on it. So for example, if I came to your office and I was like, hey, here are my financial goals moving forward. And you're just like, all right, Matt, you got 2 minutes. Here's my stock recommendations. I don't give a about your goals, where you are right now, what your future's going to look like, et cetera, et cetera. I'm just going to give you this plan. I would be like, I'm out. I don't like this at all.
Right.
Versus in healthcare, like that's just assumed like, oh, that's what we're going to get. I'm going to go to the doctor, spend like 3 minutes with them, and here's what I'm going to get. Versus I think most people are like, I want someone who sits down and says, discusses with me. Here are my health goals.
Yeah.
Here's where I'm at right now. Here are my barriers. How do we tackle these so I can really get my health to a really good level in the future? I want to have that discussion.
Yeah, you want to have that hour conversation because it's important, because it's one-on-one. It's your health. It's your financial well-being. It's your health well-being. It's what keeps you here. If you're not here, there's no financial part to worry about, right? Like really.
Exactly.
There's no legacy. There's no nothing. So where are you going forward? How can people get a hold of you if they wanted to have a conversation with you? But what do you think are the next steps if they were like, all right, this is interesting. How do they get a hold of you and where do we go?
Yeah, I mean, the best way is, we have a website. It's www.blueoceanhealthdpc.com. You can book a complimentary consultation on there. Leave a link for that. We offer a free 30-minute consultation. It's phone call, Zoom, Google Meet, and we kind of have a conversation there to begin with before anyone even officially signs up. Hey, what are your current frustrations? What are you looking for in a doctor, et cetera, and how can we potentially help you in that arena? You can also enroll through our practice. You look through it. It goes a lot more detail about what we offer. You can call our office. Our office is 267-405-1884. That's our office number. We can chat with you. Those are probably the best ways.
Oh, I really appreciate your time. It's super interesting learning the direct primary care route because it's not traditional, right? But you want to get back to what's traditional in healthcare because that's where it was back when we were growing up.
Yeah, exactly. Well, thank you for having me.
Yeah, appreciate the time. Thank you.
Thank you for listening to the Compass Wealth Conversations podcast. Click the follow button to be notified when new episodes become available. Visit our website at www.mycfsi.com. That's www.mycfsi.com. Or give us a call at 610-449-9900. And don't forget to click the follow button to be notified when new episodes become available. The information covered and posted represents the views and opinions of the guest and does not necessarily represent the views or opinions of Compass Financial Solutions Incorporated. The content has been made available for informational and educational purposes only. The content is not intended to be a substitute for professional investing advice. Always seek the advice of your financial advisor or other qualified financial service provider with any questions you may have regarding your investment planning. Please note that the information provided in this podcast is for general informational purposes only. All opinions expressed by the hosts and guests are solely their own opinions and do not reflect the opinions of any institutions or entities they may be affiliated with. This podcast should not be considered as financial or tax advice. We strongly recommend consulting with a professional financial advisor or tax professional to get advice tailored to your specific situation before making any financial decisions.